Hi everyone, I'm Dr Lim Baoying. I'm from Sports In Clinic, also known as Shoulder and Elbow Orthopedics Clinic. I'm a triathlete and also runner and also recent gym enthusiast. I've completed 3 full Ironman to date and I've been running more than half of my life, completing multiple full marathons to date. Today I'm going to talk more about triathlon related injuries. The most common injuries that triathletes can actually encounter will be actually classified under either acute injury, that means accidental, unexpected injuries, or overuse injuries that count for a very large proportion of injuries that take away our time from triathlon. As a triathlete myself, and also commonly amongst my friends who are triathletes, one of the most common injury would be that of patellofemoral pain syndrome. That means there's pain that's in front of your knee that prevents you from building up your running mileage. Related also could be things like stress fractures, usually of that of the lower limbs, and usually that is related to your training load. For upper body, because it also involves swimming, a lot of rotator cuff injuries, whether it can be tendinopathies, it can be tendon tears. The lower back being the link between the upper and lower body, that's commonly injured as well. So it can manifest as a simple low back pain, or it can be things as serious as that of a prolapsed intervertebral disc as well. Being multidisciplinary, it means that the body is put through different demands for different sports. Because running, biking and also swimming, these sports that involve different use of the body. And of course, because of the high volume of training that's required for triathlon training, the accumulated fatigue is one key factor that actually complicates the rehabilitation of these injuries should you get injured from any area. The biomechanical demands of the different sports itself may actually emphasize your training to build up certain muscle group, and that actually may make the rehabilitation of the injuries of a particular injury a bit harder as well. So let me just give an example. If you actually get very good quadricep, the muscles that's in front of your thigh from cycling, that actually may precipitate you having more injuries in front of your knee because of the increased patellofemoral force, leading to patellofemoral pain syndrome. If your legs are really well developed from your cycling and running, usually you find that you're yourself not being a good swimmer, and that may predispose you to actually getting an upper limb injury simply because you have to put in more stress when you're actually putting yourself through the swim training as well. Of course, coming from different backgrounds as a triathlete, usually a triathlete don't come from a triathlon background. They usually come from a pure running background or pure swimming background. The demand is also very different, and when you have to transit into a multidisciplinary sports like triathlon, you'll find yourself very hard to cope with the training load that's required. And of course, of the training volume and inadequate rest and possibly inadequate nutrition from your training itself, that may also cause you to have a more difficult rehabilitation process when you're trying to recover from any specific injuries. Key elements for effective injury prevention program basically comes down to crafting a very good structured training program, possibly with the help of a triathlon coach so that he can actually provide you a good guidance overall. And of course, making sure that you are able to periodize your training program across an adequate time frame for you to build up for your event. And of course, overlooking your overall health and fitness itself, including your mental health, are basically the key factors that will make or break your triathlon training program and make sure that it actually helps you to adequately prevent an injury as well. Why I propose the use of a training coach as well is that this coach itself is a neutral party. He or she can actually overlook how your training load going over the time. Are you progressively overloading yourself and you're not suffering any injuries or overuse of any body parts? He or she should also help you overlook your performance matrix and also different health matrix such as your heart rate variability, how's your resting heart rate like, how's your sleep quality and quantity like with respect to your training volume. And he or she should be able to adjust that according to your different life expectations. Of course, you must keep in mind what's the leading time up for your event that you're training up for, and so that you can properly build up the training program to prepare yourself adequately for the event. Of course, recovery techniques is very important as part of the injury prevention program. So you actually have to overlook at your own health matrix, such as your body weight. Is it actually dropping drastically with your training load increment? How's your resting heart rate like? Is it creeping up over time because you're stressed over work or the training volume is just too high? And just make sure that you're not falling sick frequently as well as a result of the training load. So overtraining is a quite common problem amongst triathletes. simply because of the training load that is placed upon the triathlete when he or she is training for the event. It's defined as the inability of the body to recover and rest after the training volume has been placed upon the person. Some signs and symptoms that can be telltale signs that the person is overtraining is that of physical symptoms and also a mood and emotional symptoms. So some physical symptoms can be that of a decreased physical performance, so that the athlete felt that he or she is just getting slower and slower despite training more and more. Increased sleep demand, the person just feels constantly tired all the time, and all the sleep and rest that he or she have done is just not adequate for giving him relief. For the mental and emotional symptoms could be that of increased irritability. Some measures to prevent overtraining could be things like, again, what's your event timeline like, so you can periodize your training so that you can actually vary your intensity and the time volume of your training itself, especially when you're still building your base, and then intensifying the training itself when it's nearing to the event itself, but dropping the absolute load of the training when it's nearing your event. And of course, skipping some workouts, especially when you're feeling extremely fatigued, because sometimes some workout and some personal best time is just not worth chasing for. And of course, making sure that you have adequate nutrition and also sleep and rest itself, and also looking for other measures that can help you to recover better, such as getting a sports massage or using other kind of therapy, like hanging out with your friends instead of trying to do a double session training program instead. Some of the effective techniques for rehabilitating common triathlon-related injuries would be that of coming through what is the problem that you are having. That means coming up with a diagnosis that you actually have that's inflicting you. You may need to seek advice from a physiotherapist or a sports medicine doctor who is actually comfortable with working with triathletes, because the demand of a triathlete compared to other athletes will be very different because of the multifaceted discipline of it. The person who you are working with should be aware of what's the demand of your body, and of course the rehabilitation techniques that are required for each specific injuries that you're actually having. You should actually also look at what's the training volume that you're having, adjusting the intensity and volume of the training again as well. And of course, taking time off to rest the particular injured part of the body. That's actually key to the start of any rehabilitation program. When we are looking at what actually caused your injury, with the help of the physiotherapist or the sports medicine doctor, possibly with your coach as well, to come out with a specific strength conditioning program to help you address the weakness that's in your whole kinetic chain itself, and to prevent you from suffering the same injury when you go back to your training again. And of course, when you return back to your triathlon training, make sure you build back slowly, and of course, give yourself an adequate build-up period of time before you train up for your next event. Nutrition is key in a triathlete because it's important for the prevention of injury at the start, and of course for your recovery as well. For the prevention part, basically it is your own physical body that you're trying to build up with your triathlon training, and nutrition is a key in supporting that. So I will look at things like what's your micronutrients. Are you eating adequately enough to fuel the high volume of training that you're undergoing? You want to see what time you're eating your meals as well. Make sure you're adequately fueled before your key training programs, key workout sessions itself. And of course, after each hard workout, you may find that it's actually really hard for you to eat in anything substantial. You just feel like sleeping, you just feel like doing anything else except to eat because you feel like puking. But I think it's very important for you to ensure that you have adequate caloric intake. So the calories intake will come in from our major macronutrients. So things like carbohydrates, protein, and also fats. So I find that having a good meal, especially with your training buddies itself after a key workout sessions, that's actually very helpful in kind of like force feeding yourself to make sure that you have the adequate caloric content in your food to fuel yourself so that you can have your adequate muscle recovery, and of course to get yourself ready for the next training session that's coming up, maybe in the later part of the day or even the next day. Of course, we would think that hydration is very important, replacing whatever that you have lost in your training itself. Okay, things like your adequate fluid intake, making sure that you have adequate electrolytes to replace whatever that you have lost in your training, like your sodium. Even your micronutrients itself, like the calcium and irons itself, are also important. First, for bone health, for the calcium, as well as vitamin D that you get from the sun exposure. And of course, for female athletes, and also even for male athletes that we cannot overlook as well, iron is good for your red blood cell production and the hemoglobin, part of the oxygen carrying component of your blood cells. You want to be able to make sure that you have adequate oxygen carrying capacity inside your blood, so iron actually is very important inside your nutrition. Race day fuel strategy as well. You need to actually train for that in your training program itself in order for you to have a successful triathlon event that you actually eventually undertake at the end of the training block. So there are some tips for you to actually ensure that you have a long lifespan as a triathlete and as a healthy triathlete. Some tips will be like, keeping yourself informed, such as subscribing to this channel when there's actually informations like this given in a short sound bites that you can easily take away from. And of course, being yourself up to date with reading on some magazines or even some Instagram accounts that can be giving you useful tips on how to actually prevent certain injuries and how to actually recover better after a bout of training. Make sure that you have a good team around you. So the team itself can be things like your family members, your loved ones, your kids, and even your colleagues as well. You can actually be their cheerleader and actually encouraging them to have a healthy lifestyle. They can join you for either the swimming part, the running part, the biking part, or if they want to, they can even join you for the triathlon part as well. So having cheerleaders is very important as part of your life as a triathlete, because you realize that this is not just a sport, but it's also a lifestyle. And of course, having a good relationship with your coach will be actually very important, because no way you can actually be fighting your coach, arguing against what he or she has planned for your training, and you're not agreeable to that, and he or she doesn't have your interests at heart, not keeping tab on what's your training versus and what's going on in your life. That's not going to make it enjoyable, and probably you won't last as long as a triathlete as well. Look at what's your recovery, and have you recovered properly from each triathlon training program and each triathlon events before you jump on to the next one as well. So this would ensure that you will have a healthy relationship with your triathlon training, and of course keeping it sustainable as a triathlete, as a lifestyle as well. Cross-train, that's a big feature of triathlon because we do 3 disciplines all the time. And when you're injured from one area itself, you can't be running because you got a knee injury, you can focus more on your swimming. And likewise, when you look at triathlon as a sport, it's a sport that requires you to be quite talented in different disciplines. Of course, with that itself, that makes triathletes much more versatile an athlete. And he or she usually are quite equipped to take on other sports as well, just to take their mind off from the hassle of being a triathlete. They're so involved in training all 3 disciplines. You can inject some other fun in your life by actually partaking functional strength training, for example, and that actually makes you more holistic as a triathlete when you actually go back to triathlon training.